Dear audience, I would like to present my 3 months progress on my PhD topic, which is comparison of hormonal contraceptives and the route of administration. I'm Gábor Vleskó, and I work as a specialist at the Department of Obstetrics and Gynecology clinic of Semmelweis University. My supervisors are Szabolcs Várbíró and Márton Keszthelyi, and the scientific methodology supervisor is Fanny Meznerics. My vision is to expand knowledge on contraception in the world so that every woman can avoid unwanted pregnancy. And the mission to reach this is to find new information that can help a wide population of women to find the best option for contraception. I have 2 projects. First one is comparing hormonal contraceptives and the route of administration. And the second one is we are investigating the role of overweight and obesity on hormonal contraceptives. The first project is investigating the efficacy and safety of combined parenteral and oral contraceptives in reproductive aged women. This is a systematic review and a meta-analysis. And I have a co-investigator, Marko Uničović. We know that there's almost 2 billion women of reproductive age in the world. And we also know that over 150 million women use contraceptive pills as a contraceptive method. And generally about contraception, we know that the effectiveness of any contraceptive method highly depends on the compliance. And there are trials that found that women using contraceptive pills tend to miss up to 3 or more pills per cycle, which affects the efficacy. And that's why we think that the newly administered new methods like a vaginal ring or a transdermal patch might have a huge space. Our aim is to investigate the efficacy, the cycle control, the compliance, and the adverse effects associated with these parenteral contraceptive methods mentioned. Our question is that are these combined parenteral contraceptive methods as effective as the oral contraceptives? The population is women of reproductive age, and the intervention is the parenteral contraceptive. In this case, the patch, the transdermal patch, and the vaginal ring. We are comparing these with the combined oral contraceptives, and the primary outcome is the efficacy measured with the Pearl index, and the secondary outcomes are compliance, safety, adverse events, and cycle control. The hypothesis is that the parenteral administration of these hormones is better than the oral route. It is more effective and goes with fewer side effects. So the clinical implication is to find the best contraceptive method for every woman. We performed a systematic search in the middle of November on the 3 main databases with the following search key, and we were concentrating only on randomized controlled trials. We found over 3,000 articles, and after the duplicate removal and the selection, at the end we have 14 eligible full texts, and now we are in the phase of data extraction. And the second project we just started is also a systematic review and the meta-analysis, and it is about investigating the role of obesity on hormonal contraceptives. A few words about the background. We know that obesity and overweight is a present problem, and it is growing, and it is predicted by the end of this decade there will be 1 in every 5 women will be living with obesity, which means over 500 million women globally. And we think that increased body weight and body fat might change the metabolic processes. It might affect the contraceptive efficacy, so it might change the efficacy, and also the adverse events adverse effect incidence. Our aim is to investigate the efficacy and the side effect profile of these contraceptive methods in overweight and obese women. The question is that are these methods less effective in overweight women or women living with obesity? we are also, the population is the women of reproductive age, and we are comparing women with body mass index over 25, so overweight patients, starting with overweight patients, to normal BMI patients. And the primary outcome is pregnancy, and the secondary outcome is adverse events like thromboembolism especially. The hypothesis is that the hormonal contraceptive methods itself are less effective in overweight women due to the altered pharmacokinetics. And we are trying to find a good contraception method for elevated body mass index. We performed the preliminary research at the end of November with the following search key, and we found over 5,000 articles. Summarizing, these are the two projects. The first is more developed, the second one we just started, and we are planning to finish both analyses this summer. I would like to thank you for your attention with the quote from William Osner, that medicine is a science of uncertainty and the art of probability.
So, hi, I am Lotti. First, congratulations to your brilliant presentation. And I would like to ask that in the second project, why did you choose the obesity to compare?
Well, as I mentioned, obesity is a present problem, and I think that there are misunderstandings among the doctors and also among the patients. So when I say that we don't have protocols and doctors have a fear prescribing hormonal contraceptives to obese women because they think that they already have some kind of hormonal problem, so they don't want to disturb it, and have a fear of adverse effects like thromboembolism and other things. And I think that also it's widespread in the patient side that if you are overweight or obese, then you should not use any contraceptive method, hormonal contraceptive method.
Thank you for your presentation. My name is Annette. And I just wanted to ask you, based on your clinical experience, which parenteral contraceptive method do you usually recommend for patients, or is there one that stands out?
Well, usually the vaginal ring is highly accepted in Hungary because we had the patch before, but then it was discontinued, so we couldn't use it. But my clinical experience is that young patients, especially younger patients, who has a modern lifestyle, they love the vaginal ring, so they know they love it. Some of them have a fear, but if you show them, they accept it, and after this, they love it. The patch, they have an even greater fear that they can't do sports, they will be sweating, or they forgot, they won't recognize they lost it or something. But those women who started to use the patch, they are also very satisfied with this. But the vaginal ring is most commonly spread in Hungary.
And the ring is the most expensive one, right?
The ring is expensive, right? But there are different types of rings. So one is like the 2/3 of the other. But it is almost the same as the oral contraceptive, or some oral contraceptives are even much more expensive.
In your first study, you are just able to show that actually contraceptives are not born equal. I mean, so there are some. And then in your second study, I mean, first of all, I mean, in the population, you didn't name actually contraceptives, just women or something like that. So, but besides that shouldn't you actually, I mean, specify more, I mean, what kind of contraceptives, because there might be an overlap.
Yes,
which as you show in your first study, that some contraceptives are better than others, and then your second study, you just put together everything, then maybe the overlap actually, I mean, prevent you to show the real difference between overweight and
Yes,
and
thank you
not.
for your question. The first project, I think we are excluding some contraceptives, so we are especially investigating the combined oral contraceptives, which include estrogen and progesterones. There are some the mini pills which only contain progesterones. We didn't include these because we think that the adverse effects might have a greater incidence due to the estrogen. And the second project with obesity, why we didn't only focus on combined contraceptives, and also we include emergency contraceptive and also the progesterone-only pills, because progesterone-only pills are the one that doctors are most likely to prescribe to an overweight women, because we think that estrogen might cause thromboembolism. So this is different in the two projects, but I think this is the reason.
If the two groups are different and treated differently, then maybe actually you get a bias in your outcome, which is not because of the obesity, but because of the type of treatment is different. I mean, I'm sure that you will address this, but...
Thank you for it. I think I will, yes, think about this.